Well, thank you very much, Mr. Chair and Ranking Member Murray, for holding this hearing. Thank you to all the witnesses for being here. I will echo Senator Murray's comments that I do not want any of us to lose sight of the fact that there are children who are still traumatized at our border today because of the humanitarian crisis created by this administration. And I just want us to, as members of this committee in particular, continue to push the administration to reunite families as quickly and humanely as possible. As to today's hearing, I thank you all for being here. Dr. Bolser, I will just say I loved your testimony about medical homes. I am the mom of a medically complex young man, and I can still remember what a difference a medical home made. I can still remember going to a subspecialist appointment with my son and trying to explain what the x-ray from another subspecialist meant, and I'm sitting in the room thinking, why is the mom explaining the x-ray to the doctor? So it's a really important thing, not just for costs, but for quality outcomes and for peace of mind for families. So thank you for your work on that. Dr. Lansky, I wanted to drill down on the issue of outcomes, how we measure them, particularly around prescription drugs. We've spent a lot of time in this committee hearing about how prescription drug prices are skyrocketing. They're a major driver of healthcare costs, and we should be working to rein them in. The Trump administration has paid lip service to this issue, but hasn't taken any real meaningful action. And I'm worried that this administration is actually headed in the wrong direction when it comes to controlling these costs. Take the recent news about what can only be described as a sweetheart deal between the giant drug maker Novartis and the Centers for Medicare and Medicaid Services. Novartis has an innovative new therapy known as CAR T cell therapy. Novartis has priced this critical therapy at a whopping $475,000. It's really amazing therapy. It harnesses the patient's own immune cells to fight and kill certain kinds of cancer, and we need to make sure that patients can access it. But it has come to light that CMS and Novartis had a pretty cozy relationship when it came to working on how CMS would reimburse for the drug, a relationship that would have set off any lawyer's alarm bells. And in fact, CMS's own lawyers were reportedly surprised and concerned, their words, with Novartis's interactions with CMS on this reimbursement scheme. The lawyers also pointed out that the agency was unusually deferential to Novartis when it came to figuring out reimbursement. That deference resulted in an agreement to enter into performance-based reimbursement that rated the drug's effectiveness based on patients' outcomes, which sounds good, except that Novartis convinced CMS to measure the effectiveness after just 1 month, when experts say patients generally do their best, rather than measuring at a later point where improvements tend to level off or the patients even may decline. So they convinced CMS not to look at an overall assessment that would be accurate. The result was a reimbursement scheme that would have amounted to essentially a blank check for Novartis. Now, thankfully, this inappropriate relationship between CMS and Novartis has come to light, and the reimbursement scheme CMS and Novartis cooked up has been halted. But I raise this issue today because it's not the first time we've seen troubling ties between the Trump administration and Big Pharma that put consumers' interests at risk. And I worry about what other kind of backroom or insider deals with Big Pharma the Trump administration may be pursuing. We need to make sure patients have access to these amazing new drugs like CAR T cell therapy, and we need to figure out how to reimburse properly for these groundbreaking therapies. But letting the drug company write the reimbursement policy is like the proverbial fox in the henhouse. So, Dr. Lansky, do you have any thoughts on how Congress can make sure that pharmaceutical companies can't rig new payment systems? How can we measure outcomes in a way that is meaningful and balanced and immune from undue influence?
Very important question, of course. The structure that is being discussed now of creating outcomes-based payment for drugs is a structure worth exploring. It makes a lot of sense, as you said. The outcomes have to be fairly long-term, long enough to capture the meaningful outcome for the patient and for a definitive therapy. We have, however, not supported as much value-based assessments as we could. So groups like ICER, which do drug assessments, PCORI, which does a variety of assessments, PCORI is, as you know, not allowed to really look closely at the long-term cost benefit of the therapies they're evaluating. ICER does look at those, and ICER probably would have data for you to help look at what is the appropriate place to set a threshold for an outcome measurement. So I think the Congress can support more value assessment strategies through a variety of mechanisms that would provide the data for CMS and others to negotiate more with better information.
Thank you very much. Thank you, Mr. Chair.
Thank you, Senator.